Today we're going to be discussing something a little different. We're going to be discussing complications that could occur with a tattoo placement. Hi, I'm Dr. Messina, President of Dr. Undo Tattoo, and if you like these educational videos, remember to click subscribe and hit the bell to be alerted to the future videos. When we have a tattoo placed, there are several complications that could occur, some more common than others. One of the first complications could be an infection at the site of the tattoo. When we're talking about infections of the tattoos, they could be either a bacterial infection, a viral infection, or a fungal infection. When we're talking about bacterial infections, they are by far the most common infection of a tattoo. The reason why is staph is located all on the outer surface of our skin and is protective against other more aggressive bacteria. Now, should the skin not be prepared properly, then the needle of the tattoo machine might take some staph from the surface of the skin and deposit it along with the ink into your dermis. That staph in the dermis shouldn't be there, and it could start to flourish and become a full-blown staph infection. Now, if you do get a staph infection in your tattoo, it's going to become raised, very tender, warm to the touch, red, first at the tattoo, then spreading outwards from the tattoo. You might see fluid coming out, followed by pus. It's different than the regular pain and swelling and redness you get when you get a tattoo. It's a bit more profound. And you might also have a fever. If you start to develop signs of an infection, it's imperative to see a medical professional right away to start a course of antibiotics. As you see in some of these pictures here, we started out with redness around the tattoo. Now, this individual has redness spreading way beyond the borders of the tattoo, and this is becoming a serious infection. It might even require intravenous antibiotics. And yes, you can become quite ill from a staph infection, especially if you have diabetes or in an immunocompromised state. One way we could avoid getting this bacterial infection is to make certain that aseptic techniques are used when placing your tattoo. It's imperative that the tattoo artist wear gloves, use a fresh needle, a fresh batch of ink, but also the skin has to be prepared properly. Any residual bacteria on the skin can be placed below the skin level and cause an infection. Then we can have viral infections. You could have an outbreak of herpes on the area. You could get an outbreak of the shingles. A lot of times, especially with laser procedures, persons who suffer from cold sores get an outbreak. And finally, we have the fungal infections, which are very rare. The fungal infection looks different than the bacterial infection. In fact, it's probably a lot less painful. However, it should also be treated. Any of these infections that I mentioned should be evaluated by a medical professional as soon as possible. Now, the bacterial infections could start to appear as early as 24 hours after your tattoo placement, and probably as late as a week out. The other types of infections, especially the fungal infections, could occur at a later date. Next, we have tattoo ink allergies. Tattoo ink allergies are very common. You might find that in the hot weather, or in the shower, or in humid conditions, your tattoos start to itch. That's a sign that your immune system is being piqued a little bit. You're releasing a little histamine, and you probably have a low-level tattoo allergy. However, something like this is a more profound tattoo allergy. Treatments for tattoo allergies can be something as simple as taking an antihistamine, as putting on a topical steroid cream, and as critical as having the tattoo surgically excised. In other words, have it actually cut out by a surgeon and sutured shut. Now you might wonder, why didn't I say laser tattoo removal if I'm the laser tattoo removal specialist? The reason why is you do not laser a tattoo if the patient has an allergic reaction to that tattoo. The reason being is you're going to release a very high ink load, and you already have a heightened immune response, and that extra ink can cause an allergic crisis, an anaphylactic reaction, which could be life-threatening. Patients who have tattoo allergies tend to have a reddened base around the tattoo. The tattoos tend to raise periodically, and they tend to itch. Also, having a tattoo could cause some unique responses, such as UV light allergies. If your tattoo starts itching when you go in the sun, you've probably developed a sun allergy secondary to the tattoo ink. If you are going to have an allergic reaction to your tattoo, most of the time it's going to be to the red ink. The reason why is red has a substance in there that can be irritating to the immune system. Now, along the lines of an allergic reaction, we could have granuloma formation. The immune system is being piqued. From the immune system, constantly trying to attack the tattoo that's causing the hypersensitivity, the skin thickens, forming these granulomas. Now, these granulomas really are difficult to treat. Sometimes you could put a steroid shot in there. Sometimes they could be resurfaced with a resurfacing laser, and other times they have to be surgically excised. And again, it's usually due to red ink. On occasion, after you have a tattoo placed, you could start to get skin reactions and actually some skin diseases. Here's a person who developed psoriasis after getting a tattoo placed. Some people might develop rashes. Some people might get atopic dermatitis or eczema. Other people have developed keloids. Keloid is a type of scar formation, and it's different than a regular scar because a keloid scar becomes raised and wide. It goes beyond the borders of the offending area. And then, of course, we could have scar formation. Scar formation often occurs from the actual needle inserting the ink, lacerating the dermis, and the dermis heals with the scar. Some persons might also develop chronic swollen glands after having a tattoo placed. And it makes sense because your body is picking at that tattoo. And the immune cells are taking it to the lymphatic system, which goes to the lymph node. And the lymph nodes become enlarged. In fact, everyone who has a tattoo, if you biopsy a lymph node, there'll be little flecks of ink in there. And when you laser a tattoo, the nodes become completely filled with ink temporarily. And that covers the common issues that we could have with tattoo placement: infection, allergic reactions, granuloma formation, scar formation, and swollen lymphatics. There's more that could happen, but these are the common ones. I hope you learned something today. I hope you have a good day, stay safe, and be well.